Guard your heart above all else, for it determines the course of your life, so says the Holy Book. Rapid, involuntary contraction and relaxation of the cardiac muscles are vital for pumping blood throughout the cardiovascular system and to the body system. To accomplish this, the structure of cardiac muscle has distinct features that allow it to contract in a coordinated fashion and resist fatigue. The cardiac muscle tissue or myocardium forms the bulk of the heart. A heart attack, also known as myocardial infarction, is when one of the coronary arteries becomes blocked. The heart muscle is robbed of its vital blood supply and, if left untreated, will begin to die because it is not getting enough oxygen. This is quite different from cardiac arrest.
A cardiac arrest is when a person's heart stops pumping blood around their body and they stop breathing normally.
While panic attack is a feeling of sudden and intense anxiety. Heart attack, myocardial infarction, is a silent killer and a deadly medical emergency where the heart muscles die due to insufficient supply of blood, life, and oxygen over time. Most heart attacks involve discomfort in the center or left side of the chest that lasts for more than a few minutes or that goes away and comes back, including tightness or pains in the chest that later radiate to the neck, back or arms, as well as fatigue, lightheadedness, abnormal heartbeat and anxiety. About 30% of people have atypical symptoms. Women more often present without chest pain and instead have neck pain, arm pain or feel tired. Among those over 75 years old, about 5% have had a heart attack with little or no history of symptoms. An MI may cause heart failure, an irregular heartbeat, cardiogenic shock or cardiac arrest. Most cases of heart attack occur due to coronary artery disease. Risk factors include high blood pressure, smoking, diabetes, lack of exercise, obesity, high blood cholesterol, poor diet and excessive alcohol intake. Obstruction within the arteries usually comes up as a result of clots, from bad cholesterol, etc. The complete blockage of a coronary artery caused by a rupture of an atherosclerotic plaque is usually the underlying mechanism of myocardial infarction, heart attack, as indicated below.
Diagnosis. Commonly used blood tests include troponin and less often creatine kinase MD.
Treatment, reversal. Treatment of heart attack is time critical. Aspirin is an appropriate immediate treatment for a suspected heart attack. Nitroglycerin or opioids may be used to help with chest pain. However, they do not improve overall outcomes. Supplemental oxygen is recommended in those with low oxygen levels or shortness of breath. In a STEMI, treatments attempt to restore blood flow to the heart and include percutaneous coronary intervention, PCI, where the arteries are pushed open and may be stented, or thrombolysis, where the blockage is removed using medications. People who have a non-street elevation myocardial infarction, NSTEMI, are often managed with the blood thinner heparin, with the additional use of PCI in those at high risk.
In people with blockages of multiple coronary arteries and diabetes, coronary artery bypass surgery, CABG, may be recommended rather than angioplasty. After an MI, lifestyle modifications, along with long-term treatment with aspirin, beta blockers and statins, are typically recommended.
Examples of surgical procedures to open up coronary arteries include
heart stent.
A heart stent is essentially a tube that is placed inside coronary arteries in order to open them up to allow blood flow. Left ventricular assist therapy, LVAT. LVAT is a pump that we use for patients who have reached end-stage heart failure. It is implanted surgically. It is a battery-operated mechanical pump, which then helps the left ventricle, main pumping chamber of the heart, pump blood to the rest of the body.